Standing for long periods of time becomes increasingly difficult as you age. Whether it's due to knee arthritis or hip arthritis or your back or plantar fasciitis, many people have difficult standing as they get older. Hi, I'm Dr. Dave Candy, and in this video, I'm going to show you some really simple tips that you can use to stand longer with less pain in your back, hips, knees, and feet. And the good news is that no matter where you're having pain, by following this simple method that we're going to use, you can decrease your pain and be able to stand longer. Plus, at the end of the video, I'll show you the 3 stretches that will help with the most common problems that give people trouble when they're standing. So the reasons that people have trouble standing longer as they age is that when you're in one position for long periods of time, it bears weight on the same parts of your joint surfaces. When you're moving around and exercising, you're alternating where your joints are bearing the weight. But when you're stationary in one position, you've got the load through the same parts of your joint. Now, that becomes more problematic as you age if you've lost some cartilage, which normally cushions the joint spaces. Additionally, when you're moving around, your muscles are changing positions and moving and active, but when you're still in one position for long periods of time, your muscles start to stiffen up and get tight. Furthermore, if your spine is not in a position where it's supporting you, or your legs aren't in a position where your bones are supporting you optimally, then your muscles have to work harder just to maintain your posture. And so finding a posture where you're bearing equal weight on your joint surfaces, being able to change between postures, and being in a posture where your spine supports you well, so your muscles aren't having to work really hard just to keep you upright. So first I want to go through how to find your ideal standing posture, even though the best posture is your next posture, meaning you should continue moving, you shouldn't stay stationary in one position. But sometimes if you're working, say if you work in retail and you have to stand for long periods, or if you're a hairdresser or your job requires you to stand for longer periods, you may have to be in one stationary position for a long period of time. Additionally, if you're cooking a big holiday meal and you're in the kitchen for a long period of time, or you're in the grocery store standing in line, or at the pharmacy standing in line, those are some common times when people have pain in their back, their hips, or their knees due to standing in one position. So to find your ideal standing posture, we're going to start from the ground up. Because if you think of your body like a tower that stands with one segment stacked on top of another, if you were building a tower with blocks, you'd want to start at the bottom and then build up. So first start down with your feet and just move around and place your feet where they'd kind of naturally fall. And that may be with your toes pointed straight ahead. It may be with them pointed out. For some people, it's even with your toes pointed in. But just place your feet where they naturally fall. Now you want to kind of move through the available range of moving forwards towards your toes and backwards towards your heels. So go backwards some and then forwards some. And if you do have some balance problems, it's a good idea to stand by something where you can hold on, or have a chair behind you, or in case you tip backwards too far, you can sit down. And just find that middle position, ramp it down, and go less toward your toes and less towards your heels. And find sort of a middle position where you're balanced and you've got sort of equal weight on your whole foot. Next, move from side to side. Move all the way to one foot, and then move all the way to the other foot, and kind of feel the weight shift, and then ramp it down and make the movement less and less, and try to find an equal balance point where you've got equal pressure on each foot. So you should be neutral from a forward to backward position, a neutral from a side to side position. Next, we're going to move up to your knees and bring your knees all the way in, bring your knees all the way out, and then kind of alternate between that. And again, find sort of a resting position where it's easiest, most comfortable, requires the least energy to stay there. And then stay in that position. Next, move up to your hips and push your hips backwards some, push your hips forwards, push your hips backwards, push your hips forwards. You might try rolling your pelvis under. When you roll your pelvis under like this, it flattens out your lower back, and that's helpful for people who have spinal stenosis or degenerative disc disease. It takes some pressure off the joints. So you want to move through a range of all the way extended, and then flexed a little bit more. Arch your back, roll your hips under, and then again, kind of ramp it down and find a position that's easy to maintain. Now, you may notice that that might be upright. It might be leaned a little bit forward. But for the purpose of this exercise, just find the most comfortable position between pelvis rolled all the way forward and pelvis rolled all the way back, and then maintain that. Now, the next position is your chest and shoulder position. So lift the chest up, let the shoulders slouch. Lift the chest up, let the shoulders slouch, and then find the position where you're most comfortable. Now, if you look at the position where you're in, you may notice that that might not be perfectly upright. And that gives you some indication as to what muscles might be stiff or what muscles might be tight. And the most common muscles that are going to affect postural problems are your calves, your hip flexors, and then your chest muscles. So if you're rocking forwards and backwards and you notice that you can't get very far going forwards before your heels start to come off the floor, then that's an indication that you may have some stiff calves. Now, if your calves are stiff when you're standing, that's going to cause one of two problems. It's going to cause your knees to either go inwards, which creates a side-to-side problem, or it'll cause your hips to go back that way. And then in order not to fall backwards, you're going to have to compensate for that somehow. So then you end up leaning forwards at the hips. And that can create stiff hip flexors, which is the next muscle group that gets tight. So if your calves are tight and you're leaning backwards at the ankles, then you're going to have to maintain your balance by leaning forwards at the hips. And so if your hip flexors are tight, that's another thing that can make you have a little bit more of a slouched over posture. Then, because a lot of people don't like to stand slouched over like this, a lot of times they'll arch at their lower back, which will cause lower back pain. Now, ideally, you should be able to lift up through the trunk, through the thoracic area, but if you've got stiff chest muscles in the front, that can make you hunched over like that, and your only available place to move is by arching backwards at the lower back. So we're going to go through 3 stretches, one for your calves, one for your hip flexors, and one for your chest. So the first stretch for your calves, you want to stagger 1 foot backwards. The one that you're going to stretch should be backwards. And you want to have your heel flat on the floor, toes pointing ahead, and then move your knee over top of your toe. You don't want to allow your foot to go outwards that way. Your knee and your toe should be in a straight alignment. Otherwise, you're kind of playing into that inward posture. So you want to make sure wherever your toe is pointed, that your knee is pointed in that same direction when you're stretching your calves. And typically you want to hold this stretch for a minute or even 2 minutes if you're able to. The longer you hold the end range position of the stretch, doesn't have to be an intense stretch, but the longer you can maintain that end range, the better the muscle is going to get stretched out. So that's the first stretch for your calves. Now, the second stretch for your hip flexors is actually very much the same position. But when you've got your heel on the floor like this, the primary stretch is on your calves. To stretch your hip flexors, you just want to kind of tuck your pelvis in underneath of you without allowing your back to arch. So you want your leg to go backwards while your pelvis is rolling forwards, and you should feel a stretch in the front of your thigh. Now, if you notice what happens with the heel here, it's the same stagger stance position, but when you're stretching your calves, the heel is on the floor. When you stretch your hip flexors, the heel often comes up off the floor so that the limiting factor becomes the hip flexor in the front. And again, you'd want to hold this position for about a minute or 2 minutes. Then the third stretch is for the chest and shoulders. And to do that, you want to be able to bring your trunk upright through your upper back without extending at the lower back. So to stop yourself from moving from the lower back, you back yourself up against the wall and get your lower back all the way flat up against the wall, even if your chest and shoulders come forwards a little bit. That's okay. Then bring your arms up kind of like a goalpost and try to bring your fingertips back towards the wall and the top of your upper back towards the wall. Now the key factor is here, you want to keep the lower back flat. You don't want to allow your lower back to arch up off the wall. So you want to make sure you're keeping your lower back flat against the wall and then trying to arch from the upper back and the chest without allowing the lower back to arch. And so you'll get up in that position with the lower back flat on the wall, chest rounded forwards, arms up there, and then you try to arch your chest and shoulders and arms back towards the wall, ideally getting closer and closer back like this. If you do have a really rounded upper back, it's likely that you won't get your arms and neck and head all the way flat up against the wall, and that's okay. You just want to move back towards that direction. So to review, to find your ideal standing position, you want to move from forwards to backwards, side to side, and find sort of a neutral standing position on your feet. Then move to your knees and go inwards and outwards, inwards, and then find a middle position there. Next, you're going to roll your pelvis under, and then arch your back, roll your pelvis, arch your back, and then find a middle position where it feels comfortable and somewhat easy to maintain. And then you're going to lift through the chest and shoulders without arching your lower back. And then you should be able, throughout the course of your day, to move through those different postures, move more weight onto one leg for a little while, move more weight on the other leg for a little while, move a little more forwards on your toes, a little more backwards on your toes, but always kind of falling back to that balanced position. So you have your ideal posture as well as the availability to move between different postures as you're standing for a long period of time. And then the 3 stretches, the calf stretch, the hip flexor stretch, and the chest and upper back stretch like that. So hopefully you did find these tips helpful to help you stand longer. If you're in the St. Louis area and you need help to be able to stand longer without pain in your back, hips, knees, or feet, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else but you found it helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.